Good afternoon. This is United Medical ACO. Today is May 6th, 2022. I'm here with Sean Donegan. My name is Kemal Erkan. I'm the chairman. Sean, how are you?
I'm doing well. Had a good Cinco de Mayo. I'm ready to get back to it. Back in our Friday sessions.
So now you've got the upgraded camera. So
I do, yeah.
This is a even.
Everyone can see what I really look like, huh?
Great. So, well, we have, as usual, we have a lot of updates. We do have a guest speaker today. This week is our clinical, and Dr. Jennifer Liquido is going to join us. And other than that, they're going to discuss a couple of our regular items. Around those topics, we are giving the updates, which will be global economy and the war and the pandemic, and also what's happening with the social media, with Twitter, and what's actually behind Twitter takeover. But we'll start with the COVID updates while we are waiting for Dr. Liquido. So let me make sure that I pick the right one. All right.
Yeah, so we'll just get caught up with our COVID numbers here. The U.S. is now in third on the list of countries having the most new infections per day. So if you remember last week, we were actually in the top 5 at the number 5 ranking, and now we're up to third. It looks like there are just over 65,000 new cases being reported on the daily. We're still ranked at first over there on the right-hand side with deaths per day, which is just over 500. Which is obviously a lot lower than when we saw that surge during the Omicron in the winter. And then our second graph here with the red trend line does start to indicate a little bit of an uptick now. As the weeks go on, you can see it's trending upward as opposed to continuing that downward spike that we're used to from the end of the winter into the spring. And then just on our vaccination numbers, we have the country as a whole, over 219.9 million people fully vaccinated across the entire US. Of those, we're almost at 101 million having received a booster shot. And then Delaware in the side margin there, we have our comparison numbers, and it seems to be continually steady, about 0.1% in each of those categories respectively. But surprisingly, the category of over 65 years of age actually did go up 0.3%. So they're almost at 95% of the population over 65 years of age having received, they're fully vaccinated in the state of Delaware. So the state is about 3 whole percent points behind the US population as a whole. But we are still seeing continually uptrend, about 1% a week. On average across those age groups. So that is good to see. And then just overall, like you said, we are going to keep our eye out for the new variants that are coming out of the Omicron. But we think that with the summer coming up, it shouldn't be as detrimental as it was that we saw during the winter spike of the Omicron, the holidays in that winter months. So.
All right. So, well, the COVID is going to be part of our life, so it's not going to go anywhere. It seems like, summertime is going to slow down. That's the same thing happened last year. But as we see some of the gatherings all together, we know that people are not being careful, and then they're going back to normal. Right. What was that event last week? The White House correspondence dinner, I believe. Yeah.
Is that what's going on?
So where let's see. White House correspondence dinner. So this was, I think, without any mask, with our president being there.
Yeah.
Maybe more than 2,000 people were in the same room.
Yeah, so it says several of them who attended.
Yeah. So even the comedian who was hosting was making fun of the whole situation. Mm-hmm. But the thing is, I think I think getting together is okay, but in what situations and how we are actually, what precautions that we are going to take, like being restricted extremely tight on one side versus not being restricted and then pay for the price later on. Like that's not something that I want to have, and that's tough. Let's see how that's going to go. Just waiting for Dr. Lucido. So I think she's in her patient hours, and then this is one of those challenges when we have our physicians with us, but we do have a lot of different topics. That we are going to talk. So well, you were going to say something.
I was going to say, if you wanted to jump to one of them. I mean, in the meantime, we do have a few items there on our agenda. So, that kind of gives her a little bit more time. She is seeing patients now.
Sure. We picked depression. This is our second round on depression. So we can actually just, your education background actually qualifies you to talk about some of these. Okay, so Dr. Likula said she lost the link and she's just signing in, no problem.
So I mean, I can just touch on my education background. We wait. It's a reminder for those. I did go to University of Delaware, double majored, so Bachelor of Arts in Psychology, and then a Bachelor of Science in Cognitive Science. So for those who don't know or aren't as familiar, cognitive science is dealing with the neural networks in the brain, development of perception, different language development in the brain, different communications on the neural networks. So it can be applied to various array of different specialties and professions on what you necessarily want to focus on, whether that's the psychology, which is what I ended up choosing. You also have the speech language pathology. So those who want to focus on the development of speech and maybe down the line become like speech teachers. Or also we have the philosophy and philosophical approach to how, thought and what you do know and the development of knowledge, basically. So having cognitive science and psychology with our recent topics here of depression and even the social determinants of health, I feel that background, I can definitely relate and understand a lot more about people and kind of what they're going through, what impacts and factors may be contributing to some of their decision making, and kind of how they may analyze a particular situation or event, and what kind of causes them to, maybe behave the way that they do, more from a scholastic approach as me looking in with that education that I have in the background. I may look at it a little bit differently than. So
with the studies that you did you do any like lab studies, or were they all classroom?
Yeah, so on the science, the cognitive science had a couple. Some of the classes I took, neuroscience, you did have a couple labs there. Other ones were chemistry, which is, your gen eds that were more lab focused. But with the cognitive science and the psychology, a lot of the classes wasn't necessarily a lab, but we did have projects that were, semester long, where you'd kind of, so like for one example, I had a behavioral modification class where the main goal was to either develop a behavior in a person or eliminate an already existing behavior. And you have to analyze, obviously, what their motives are, their reward system, what types of conditioning you'd have to basically reward them and continue a behavior. So if you think of the famous Pavlovian conditioning, the example of ringing the bell with a dog and you feed them, it will cause the dog to salivate, or associating certain things. So I may have mispronounced the name, but so there's a lot of different projects that we did have that I feel like I can actually relate to, kind of what we're seeing here with different people and their behaviors, and especially during this pandemic, on these outside factors that may be influencing certain decisions that they're making that maybe they're not accustomed to or they've never experienced something before. So it'll be interesting to kind of have my take on some of these things that we're going to be discussing here in these live events.
Absolutely. So actually, sometimes I do forget your major, because like you're a really important football player for Delaware, right? So then because of that, I'm always kind of like, oh, maybe Maybe we need to pay more attention to what you really study.
So undercover here. Not here profiling everyone, so be careful.
Yeah, we won't do that. And I believe Dr. Lakito just joined us.
Hello, I am so sorry.
You are fine. You have a great excuse. You are seeing patients.
Yes. Yep. Sometimes we can't control, right?
Absolutely. So how are you doing?
Doing well. How are you?
Good, good. So just we just started with the topic on the depression, and depression is a huge topic, and it's not something that we will be able to cover. But today, since you are a pediatrician, we wanted to focus on depression in children, and the reason we are actually we are pointing out this issue is because it is becoming a bigger problem every day. So we wanted you to kind of educate us, and then we have some questions, maybe if you have time later on.
Okay. Yeah, actually, it's good that you pointed out that it's becoming a bigger problem. Actually, last year around fall, like October, I think, the AAP, so that's American Academy of Pediatrics, together with the American Child and Adolescent Psychiatry and the Children's Hospital Association, declared a national state of emergency for children's mental health, just because of we've had this problem, and then during COVID, it actually doubled up, like the rates of depression and anxiety globally. So they did declare this as a national emergency, so as to increase, hopefully to increase support, increase more funding for services, so that kids can get help.
So what is causing more depression in children, Dr. Lakito?
Pretty much same as adults, although we have, of course, to be mindful of presentation on younger kids. So it can just be irritated, with adults, we have similar with adolescents: depressed mood, diminished interest, significant changes in maybe like eating and sleep. Now for younger kids, it can just be irritability. It can be, being defiant. The DSM-5 criteria would still be, following similar similar criteria about the symptoms. And then, of course, for depressed mood, you say, for 2 weeks, then you could say that it's a sign of depression. But if if these symptoms are present for more than 6 months, then it is a diagnosis of a major depression. For anxiety, younger kids may still be the same way. Some restlessness, not eating, not sleeping, being hyper focused or hyper alert. This could be, signs of anxiety as well.
So do you think it has something to do, this is just me, just from the outside observation, do you think it has something to do with maybe parenting, like that also kind of change how parents are with the kids? Like you and I, we are about same age, so what our parents, how they were with us versus how the new generation parents are, they're different, or actually people our age became parents, and then we are trying to just do things a little bit better than supposed to be, better than our parents, and then I don't think we are doing that. Do you think that has something to do with it?
A little bit, but definitely there's, it's nature versus nurture, right? Definitely more a mixture of components. Actually, it's interesting because Dr. Carrie Rizal, we were just discussing this a couple of days ago, I think, because we are, the kids we see like from birth, And then you see them like, like maybe like about 2-3 years old, that they present with a different affect. So even then you could see that there might be something that's different, that's not manifesting yet. And then come later on, once they can describe how they're feeling, if they sometimes they do poorly in school, then oh, okay, so maybe those symptoms from before are signs of this already. But then definitely with like a nurturing environment, with support at home, with parents who are more aware and more in tune with their kids, things can be sort of like being managed a little bit better, and they get help um, a little bit faster before it becomes a little out of hand. So there's like there's biology, and things are really there are people who are really susceptible to it. But then definitely like disciplining, not just disciplining, but the presence of a very supportive home environment matters. Of course, we need to also be mindful about the effect of social media, triggering a lot of the stuff as well. So may not be causing them a lot, but it can make them more difficult for kids nowadays.
What can they do with the social media though, the parents? Or what
Well,
is it that they should be doing?
well, that's part actually of like the diet. We whenever we see kids for their well checks, okay, you say these are the dietary recommendations, these are exercise recommendations. Now you also have like media recommendations that you limit, even the younger kids, you limit their screen time to no more than 2 hours a day, so that you can get them engaged more in other activities. uh, a little bit of caveat on COVID, of course, because kids, would need more access to computers uh, because of their education. Plus, even I think all of us increased our use of social media and computer because we need to entertain ourselves. So that they're thinking that might also be a factor about the increase in anxiety and depression in kids during the pandemic.
I guess that's because the part of the depression is like what's causing depression is the isolation. And with the pandemic, that isolation actually is at the greatest level.
Yes.
Right? So that
Yes.
just triggers that at a really high level. Now, in terms of the treatment of the depression and anxiety, since the population is different, how is it treatment options are different, or what do you do differently?
Yes, very different. So we talk about first like the challenges of like the younger kids, and unfortunately we don't have a lot of them. We don't have a lot of access, and we don't have a lot of easy access. So that's actually something that is a challenge for us. So for younger kids, it's we call them like play therapy or cognitive behavioral therapy, so that they can sort of like be treated on, of course, on the level that they understand. And of course, these kids really don't know what's happening with them. They just feel differently, and they could not, of course, talk about why it's happening. Actually, even adolescents sometimes, you go in there and you ask them what's happening, and most of the time they just say, "I don't know," and I don't know why. I don't know why this is happening. So that's the role of counseling. So across the board, the therapist will be the first line, but of course, they have different approaches for kids versus for little kids versus the older kids.
Now,
Uh,
just for our discussion, just for our discussion standpoint, when we are saying children, can you just clarify the age group that we
well,
are referring to?
yeah, well, it'll be 0 to 18.
0 to 10.
Well, before 18 will be 17, but of course we see them until like 19, 20, 21.
Um, Now, if I'm just thinking, like, if let's say someone has a 9-year-old and they need to see a therapist, so they're not going to be alone with the therapist.
No.
So can you walk us through that process, how that works from the parent standpoint?
Well, even in here, like when we see them with these problems, of course, the parent should be there, but we do request some time alone with the kids to ask them some information once they're, of course, old enough to talk to us by themselves. The parents, most of the time I ask them to step outside so I can talk to the kids alone. So I can ask some questions. Sometimes kids open up a little bit more without the parents not being there. And I think this happens in the therapy places as well. So we refer them. Most of the time, the therapist would schedule with the parents, so the parents will be inside. But they do, most of the time they do the interaction with the parents in the room as well. Yeah. Other than that, we might need a guest therapist to tell us how else they're doing things.
One of the interesting statistics that we have, so while actually for the adults, it's more common with women, it's almost twice more being in depression. In the kids, children, boys actually are more depressed than the girls. So it's about 9.8% of the boys versus 7% of the girls.
No, it's actually higher in girls too.
No, this is from the National Center for Health Statistics, 2019 data. So, yeah.
Okay.
So I actually, maybe like in time they are.
Maybe, but what I had the JAMA pediatrics review.
Well, the girls are smarter when they're younger. So.
No, but the thing is, there's also a lot of thing with girls with being less, they typically girls would have like less less, a lot of girls, or should I say, but not like typical for girls, like a lot of self-confidence issues, being depending on the setup at home. There could also be some physical or emotional, more susceptible to physical and emotional abuse. So actually, we have some conflicting data. What I got was like, it's still higher in girls, higher in older children, and higher in lower socioeconomic status. Yeah. So maybe we need to see. Right. Maybe we need to see which data we have.
Yeah, this is the one that we have is from the mental health treatments 2019 NCHS data. And then Sean, you can actually just.
Yeah, sure.
So we're in the same room now, so it's a little bit easier to communicate. Go ahead.
Yeah, so I was just researching here too. And one of these articles we have here, it's from the Pharmaceutical Journal as of 2021. And it says, it's actually just titled that the number of young children prescribed antidepressants has risen by 41% since 2015. I'm not sure if you want to touch on maybe just like, is it more common that we're kind of relying on medication, not necessarily more easily, but that might just be an approach that's taken. It's increasing now as opposed to in the past. They may not have been so easily, recommended. So let's just try medication right off the bat as opposed to other approaches initially, maybe?
It's hard to say if we're just resorting to that right now. One of these things may be more of like acceptability, because right now, like, even probably the adults around them are more accepting of the medication as well. Okay, so there could be like familial tendencies to have depression, and if some adults in their lives have experience with the medication, then they will be not susceptible to agreeing to medical treatment as well. Well, I could tell you that there are a lot of kids actually who like in our experience, of course, we refer them for therapy initially. That is the initial treatment. A lot of them don't go on medication until we see that the depressive symptoms are getting worse. So I don't have any experience about kids being diagnosed and being medicated probably within a couple of months, unless it's like a severe presentation already, kids that we don't, yeah, yeah.
Okay.
So we, as you know, we do have our daily case conferences, and our nursing team, us, our central office, myself, Dana, Sean, Kim, we got all better. Our social workers now, we have two. One of the challenge is when we are dealing with the kids. Are we overreacting? Are we catching them right on time? When is the right time? Or that balance is a little bit more difficult when you are dealing with adults. And but when you don't actually catch them, when you don't interject right on time, then the results can be really severe. And then we have seen a couple of patients in the last 12 months. One of them was our patient, one of them is not. It just went to an extreme level of committing suicide. What do you like? What should the parents be doing? Like, what's the best way to really say that, okay, my child may have an issue, like I should be looking for help, like, because there's still a little bit stigma, like you don't want to label your child.
Yes.
My child has depression. Like, as soon as you put that label, then it's just like last night. Were you at the obesity discussion last night?
No, I was not.
Dr. Phil from Highmark was talking about morbid obesity treatment and the stigma of it, and he did mention the mental health being part of it. If you talk to my mom, and then if you say that, well, Kemal probably needs therapy, like she's not going to be happy. And I'm 48 years old, right? So when you take that to like a 9-year-old, that becomes even more sensitive. So what do you suggest that they should be doing? What's the right approach? And what are the things that they should be looking for?
Well, the home environment is very, very essential, of course. They should be looking for any changes on how the kid's routine is. Okay. And they should be asking questions. They should be engaging the kids. So, even, as I've been talking about it earlier, changes in sleep pattern, changes in eating pattern, eating more or eating less, irritability, okay, how they engage with the parents, even clothing, the way they dress up, even some changes on that. They should be asking more questions about how the kid's doing and why they're doing that. So even if they say no, even if they don't want to engage, they just have to keep on asking the kids questions. I couldn't tell you the number of times that the kids come here for a physical exam. Of course, we undress them and we see cuttings, like scars, and the parents don't even know. So
how do they miss that?
They're covering it up. Kids begin, always wearing long sleeves in the summer. You should be wondering sometimes, like, okay, is it medical? Are you always cold? Is this something that we need to go to the doctor for? Is it just you being all cold and everybody else is warm? Of course, we have to think of some other medical illness, but if not, then, if they're like that, they're always in their rooms, they're not engaging, then we need to be asking them more questions about how they're doing.
So that's interesting. So, our discussion is kind of also timely because this month is also the mental health month, right? Now, Anything you would like to add? And Sean, did you have any question that you didn't
I just
cover?
had, maybe it's kind of like a general, but I know you just keep touching on like anxiety, and I know that especially like related to school, I know there's a lot of pressure put on kids that they have to perform at a certain level. Is it the fact that we're seeing it now happening more often, or is it more of like how they're handling it? That's kind of the concern. Is it, that they're just being stressed all the time, or is it how they're going about, like maybe there's certain coping mechanisms that they're relying on that aren't necessarily the best method. So I'm not sure, is it necessarily an increase, or is it just the way they're going about it that's more the concern that you're seeing?
Yeah, I think there's definitely an increase. But again, at the same time, like you're right about those things as well. There could be a factor of the coping mechanism, more stresses they have right now, more exposure to social media, that they're seeing all these things right now, about how you're supposed to be, image of success, what success is, how one is supposed to look, how friends are supposed to be, and you get barraged. You don't before, like, Kemal, you and I, you grew up, you're in school, you go home and it's family, right? You don't have, you barely interact with your friends. You don't even talk to them on the phone, after you rarely talk to them on the phone when you're at home. But right now, if there's bullying in school, that bullying can persist even if they're at home and they don't have any breaks. So
In our time, that would stop at some point.
exactly. Yeah. You go home and you can
Although I
forget
had my
about it.
so like since I had my older brother, so it would never stop. Mine was 24/7. So,
But I bet you can fight back at home
I
more
did.
than you can in school.
But then I left the country.
Oh, that's why you left. I
So,
think I bullied my older sister too.
no, my older sister always protected me.
Oh.
So now, from the practice standpoint, you and Dr. Kerry Roselle, you guys are open for new patients, for same-day patients,
Yes,
same-day
we are.
appointments.
Yes, we
The
are.
help is available, and then we work together with our central office. If there's any patients who needs follow up with therapists and other social worker type of service, we are actually taking care of those patients. And unfortunately, with the social determinant of health becoming more and more clear to us that everything is changing, the poverty level is changing, because more than 30% of the population is living under poverty level. So this is the Medicaid population. And then most of those patients are kids.
Yes.
So that comes with poverty, comes with financial insecurities, food insecurities, and a lot of other things are attached to it. And as that population is growing, I think our challenge is growing as well. So this becomes more like the team approach. And I just want this channel to be kind of like an access to those people who are looking for help. And then if they can learn something from here, or if they need help, they can always reach out to us. So that's what our kind of goal is. And I know you have busy office hours today, and then we took you away from your patients. But did you want to add anything before we let you go to your patients?
No, I think this is a good discussion. And you've said, like, we're just skimming the surface. We're not even going in depth into it, but it's a very, very, very relevant topic, and it's getting worse.
Yes, definitely. I mean, this even with the adults, like this, it's in the top three. Like, right, what we see every day.
Yeah, like even if you just see in the news too. I know one of our slides in here, we even just touched on the college athletes. That's recent in the news that it's becoming more. I think there was 3 in the last month. 3 girls who actually all ended up committing suicide, and it just seems like it's obviously a growing concern in our society. And we're seeing it more in the news. And I think the more educated we become on it, it's, the more you understand a topic, what causes things, how you can approach them, what are some alternative approaches if the initial one isn't working, how you can handle it. I think just the more educated people are on it, even from children all the way up to adults as a parent's approach. Obviously, the more you know, the better. It can't hurt knowing more on the topic.
Well, Dr. Nikito, thank you so much for joining us.
Thank you, Kemal.
We'll see you soon.
Sorry for being late. We'll see you soon.
Bye-bye.
Bye-bye.
Bye.
All right, so Sean, our next topic is our global current events. We may not have time for a tutor, if you are going to discuss this properly. But let's see how much we can cover. So this week, what happened was Fed raises the rates.
Yeah.
So
yes, we have a couple of slides in there. I think the example that this article actually used is a family trying to actually get a mortgage for a house, and they're just showing you over the length of that 30-year mortgage how significant even just a 1% changes of. I think in the article it went from paying maybe like 187,000 like over 240 or something.
So they would go monthly payment by increasing 1 point of mortgage for 30-year fixed rates. Their monthly payment would go from $1,340 to $1,520. So that is.
In the long run, it went from a total of 185,000 paid in interest to over 247,000. So obviously that 1% is super significant.
So, well, that's important. So, and then many people probably are reading and maybe watching the news, hopefully, but just kind of summarizing what happens when Fed raises or lowers the rates, but what are being affected immediately or in the midterm. So what we know is our credit card rates are going to be impacted right away. So if anyone who are not paying their credit card balances every month, then you are going to be paying more interest for those, and that will start right away. The savings and CD rates are going to go up, so then some people who have money in their savings, they can get more interest. So as you were saying, the mortgage rates are going to go up. Although this may not happen right away, the impact may not happen right away. So that's going up is going to impact the housing market. Correct. So then the house sales are going to be dropping as they're going to be more expensive.
Yeah.
So there's some stuff are not clear, because part of the reason that inflation is there and then the prices are going up because there's a demand.
Yeah.
So if there's a demand, then you would think that people are doing well, but there's a little trick there.
I mean, if you look across, the different sectors, I mean, some of it is a direct relationship, while others may be indirect. Like you're saying, with the interest going up, the prices, house demand, people aren't going to be as eager to go out and say, let me jump on a loan if it's going to be way more expensive. Obviously, you can always refinance though with mortgages as an option, but other things, you're kind of stuck on. It's a numbers game.
So most people who have home equity loan, those are going to go up. And so people are going to pay more interest on those, and because they're not fixed rates, so that will be happening right away. Right. Auto loans are going to go up. That means auto sales are going to drop. So it's kind of like the government doesn't want you to spend more money anymore. No. But that's why I was saying that there's that little trick that, so they are the one who actually stimulate the economy with fake money.
Yeah, printing all this money with no, it's just a free handout basically. Now they're saying that they kind of don't want you to spend it, so it's kind of. And
the investment returns can be impacted by this whole change. But one of the interesting thing is, so my brother-in-law sent me a message earlier, right before this one actually, and he lives in Turkey, and then hopefully he's watching, but he was telling me, the U.S. added 428,000 new jobs in April. So, and I was trying to explain this. So the Turkey economy is a little bit, of course, worse than here. But when you're, on top of the world as the United States, so the things are a little bit different. But if we sneeze here, there's a hurricane in Turkey. So now that's given, right? But the problem is this. We have those people, that many people, they have to get new jobs because they cannot afford living paycheck to paycheck anymore. They need more money. And that's what we were talking about, right?
Yeah.
So explaining this is very difficult. So now what you have on the bottom video, those are the pictures that I took, those gas station pictures. And then this is in the last 1.5 months, like 6 weeks. You see the diesel going from $5 to $5.99, whole dollar. We haven't seen that, and no one is like saying that. Why is this even happening? And we have been saying this. So now we told you so. Yes, we told you so, but now we are paying altogether.
Yeah, that's what I was saying. That catch up is actually starting. We're starting to see it now.
So with these people finding second jobs or not having enough jobs, the thing is we are not able to find qualified people for the jobs that we are looking for. Less people are applying. They are stuck somewhere, or they are not coming back to work, because this unemployment also is kind of like the way that it's calculated it's also tricky. So that it's not so clean. So what else do we have there?
Yeah. So in our video slide here on the loop, you have a couple. I just threw in, I think one's from Yahoo Finance and then one's from the Market Watch on basically the more stock in the market sense on what we're seeing with the economy, on how the one article is basically saying that, this bear market actually isn't going to be as bad as some may think, and that, comparing it to the other big bear markets that we've seen over history, the Great Depression, the dot-com bubble, housing market, that a lot of the signals were kind of relatively the same, but we're almost on our way out. So that was the one approach that the one Market Watch was kind of going for. Then the other one on Yahoo Finance was actually saying that it's more dangerous on this most recent plunge, which it was actually pretty significant over the past, like this whole week. It's been like 11% or so on the market.
So I think one of the other things that we wanted people to know is, so the pandemic was already bad enough. The war in Russia is not just this isolated war. Again, the hypocrisy is one of the most deadly disease, probably most dangerous disease, let's call it. So when people in Tigray in the last 2 years, when they were dying, no one cared. Now, this happened in Ukraine and Russia, and then all of a sudden this became a big issue. Right. We understand or don't find. But the problem is this. Now, Europe is taking a really clear position against Russia. Every day, this is escalating. So initially, my opinion was, this was going to happen in the 1 week. It was going to be just happening, and they were going to just close the issues, resolve the issues, and then get to the bottom of it. And whatever was going to happen that time. So this is escalating every day. Now, there is another pandemic maybe coming to our way from China because they are restricting public transportation in Beijing. Now, European Union is announcing new sanctions to Russia, and the tension is getting greater and greater, and it is not getting any better. So, what may be coming to our way now? What's happening in the United States. I've been here for 23 years. This is the first time the inflation that we have is in the last 40 years. So
Yeah.
we haven't seen this in the last 40 years. So in the last 23 years, we definitely didn't see it. So things are happening, not in a good way. Well, one of the things, we are going to prepare some stuff for you guys later on. People who are willing to run this country, their age varies from 74 to 80. Well, youngest being Hillary and oldest being Bernie. The current president's at 79, and he's talking about rerunning. Help them, like how much energy they have, and Trump may be rerunning. And then these guys are in their late 70s. And Sean and I, we were talking about whether or not we would let them, like, would I hire a CEO for my company who's at age 75? Absolutely not.
Another example, let them manage your stock portfolio.
Yeah. So, well, let me ask you this.
Sure.
If one of your family members is really needs this important surgery and the surgeon is 79 years old, would you be comfortable doing that surgery?
Shaky hands. You definitely think twice on that.
Okay. So we need to think twice for our choices for the country. People who are running our countries, these people are old and they really don't know what is happening, and they are not making the right decisions. The war is not a solution, and more people dying is not going to get us anywhere. And this is concerning because we are talking about depression earlier, and we are trying to help the population in one way. People in Tigray are dying, no one cares. People in Ukraine dies, everyone cares, and the media is pushing everything out to our way. And this kind of needs to be under control in some way. That means some stuff has to change. Some certain things has to change. And in order for that to happen, we need to have clear communication. I think Twitter should be a good discussion perhaps for today, but we are kind of running out of time. But having those bot accounts on Twitter, deciding who's gonna run, who's gonna actually win the election,
based on,
right? So they can influence. So that maybe is where we can pick up next week, because maybe Elon Musk is doing something good without being too political.
Obviously his approach on, what he's doing, I don't think it's necessarily favoring one side or the other. It's just, straightforward. This is how, you can take it as you want. Some people all of a sudden they're all against it. Like you said, they weren't necessarily against it when somebody else, had the CEO title, and all of a sudden now that it's him.
Well, imagine this, like 99% of the Twitter employees are Democrats. And they are the decision makers. And then how can Twitter be objective on anything?
Exactly. It's obviously a bias.
So now when you clean it up, they don't want that to be clean anymore.
Right.
Why?
Like you said, the hypocrisy earlier.
Right.
And I know we don't necessarily, I don't think we have the Twitter slides up there, but I know, like you said, we may touch on this next week, but even recently there was one article that we do have mentioned with Clinton and Obama and the other staffers of the European governments are behind the anti-Musk campaign to force big corporations to boycott Twitter after Elon demanded to know, quote, who funds these organizations. So all of a sudden,
George Soros is part of it. So
once the light is shined on them, all of a sudden, it's no, this isn't okay. You can't do it.
But they are making, they are interfering with our lives, and they have no right to do that. So, but I wish we can actually discuss more fun stuff. But we are here discussing the pandemic. We are here discussing all the other war impacts, the war impact. Like you are 23, 24-year-old who is now dealing with inflation. Like, this shouldn't be happening. And people who are over 70, they are picking up second jobs. And my brother-in-law, again, if you're listening, which I'm going to call you later today, they are taking jobs because they have to. They don't have a choice. Now, your government is giving, it's almost like extremely social government in Turkey, where when someone is married, if the female, if they quit in the first 12 months of the marriage, then they can still get severance. There's an incentive to quit their jobs. And then, yes, maybe we are talking about having a lot of financial issues in Turkey, but 30% of the office quit and then find new jobs. And then we have one of the really high paying jobs there in our office. Mm-hmm. And if they can change jobs that quickly in that economy, that means the economy is not that bad.
Right.
So that's what I have to say. But I wish that we could actually discuss more fun stuff. So tomorrow we do have something fun though.
We do, yes. Color run.
Brandywine Valley SPCA. I'm one of their advisory board member. We do have the color walk or run.
Up to the discretion of the participant. They can finish it as fast or as slow as they'd like, yes.
United Medical has a team and we will be there tomorrow, hopefully. We can see a lot of people. Even if you are able to come last minute, that should be fine. Well, this was another good episode, hopefully. Thank you for being with us.
A lot covered here, and it's definitely we can definitely expand in our next week or two on some of these points that I think we'll definitely have new news and updates coming out.
Absolutely.
Hopefully for the better. But
absolutely. Well, thank you so much, everyone. Thank you for watching us, and then we'll be back next week. Thanks. Bye-bye.